Hello friends, I am Dr. Anand, Assistant Professor, Subharti Medical College and Consultant Nephrologist. In today's session, I will discuss the chronic kidney disease or CKD and its association to the pedal edema along with its causes, symptoms and treatment. So first, let's see what is the chronic kidney disease is. It is basically defined as the continuing and the permanent degeneration of the kidney is known as a chronic kidney disease. The kidney is a vital organ of the human body, and it's responsible for the mainly the electrolyte and the fluid balance. It has multiple actions. It's also responsible for the production of the red blood cells, maintaining acid base balance, and excreting the water soluble waste. So basically, the CKD are the five. CKD has the five stages. The from stage 1 to stage 5. With the stage 5, there is a kidney failure, and it is defined as if the estimated GFR is less than 15. So it is known as the end stage renal disease and end stage kidney disease. So what are the symptoms of the CKD? The CKD are is symptoms as a quite non-specific one. So you should be vigilant about your kidney function. So what are they? Swelling of the feet, ankles, and the pedal edema, swelling and of your feet, swelling of your abdomen, swelling of your eyes, nausea, vomiting, loss of appetite, sleep problem, urinating either more or less, diminished mental sharpness, muscular cramps, high blood pressure, and definitely the shortness of breath. So out of all the symptoms, today we discuss on basically the edema, causes of edema, and treatment, little bit about the treatment of the edema. So the pedal edema is a swelling of the feet, ankles caused by the abnormal buildup of the fluid in the ankles, feet, and lower legs. Edema of the foot can be caused by the two different mechanisms and happen in unseen or the separately. So the pedal edema linked to the chronic kidney disease is either most commonly due to the impaired kidney function. Kidney is notable to maintain the fluid electrolyte balance, and the secondly due to the loss of protein through the passage of urine. So through the passage of urine, it is known as clinically, this is the nephrotic syndrome. Nephrotic syndrome is basically loss of protein in the urine along with the edema. So your body oncotic pressure is decreased and reduction of the blood volume, and this leads to the edema formation. Okay, and second one, if the kidney is not able to maintain the fluid electrolyte balance, the more water is retained in the body, and this causing the increasing the hydrostatic pressure, formation of the edema. So pedal edema symptoms include the swelling, puffiness of your tissue just beneath the skin, or the skin is a stretch or the shiny skin that retains the dimple pits and after being the pressed for the several seconds. So, what is the treatment available for this pedal edema? There is a multiple modalities, but the non-specific one, the first of all, you have to restrict your water intake and the salt intake. The salt intake should be restricted. Your sodium intake should be less than the 2 gram per day to minimize the edema. Second one, though it is a cumbersome, this is the compression stockings. It should be applied here with the edematous spot, and it should be applied a minimum 30 minutes for the 4 to 5 sessions per day. Third one, this is the body. This is the body positioning. That means that if you elevate your legs for the 30 minutes for the 3 to 4 time duration, so there will be little bit drainage of the fluid which is present in the dependent part of the body. And lastly, this is most importantly for our therapeutic purpose, this is the diuretics. The diuretics has an immense role to control the edema. What are the diuretics we have? There is the mainly in CKD patients we use the high efficacy diuretics, either torsemide or the furosemide. But torsemide is much better than the torsemide is much better than the furosemide. It eliminate the more water and salt and reducing the edema. By eliminating the too much of the fluid too rapidly can drop the blood pressure also, and it causing the lightheadedness, fainting, and also the little bit of the electrolyte imbalance. So after using diuretics, you may need to empty your bladder more regularly. This is one of the side effects of the using of the diuretic, that you have to go more frequently to urinate. So however, the diuretics is used as a prescribed dose, and it is mostly compliant and mostly effective treatment to treat ankle edema. Thank you very much.